luminaries and distinguished British Bangladeshis who are present here, distinguished guests, very sort of good evening from Bangladesh. Actually, I just came for this event and I feel privileged to be with you this evening. I don't know how much you know about BRAC. I know that the BRAC UK has been doing a very good work for the last few years, trying to let the British to know about what BRAC has been doing in Bangladesh and also in other countries. But since I have flown, I think I should give you just a few figures about BRAC and what we do. Actually, we pursue an inclusive development in Bangladesh. We started in 1972. We just celebrated 40 years. By inclusive development, we mean that two of the organs, important organs, the government and the private sector, the corporate sector, they provide services to the country. And we pick up those households who are bypassed by these two organizations to bring them into the fold of development in Bangladesh. So now we have quite a large number of programs. There are about 9. We divided them into 3 pillars. The first 3 programs, which are basically providing financial services to the people in order to generate employment, basically self-employment, and also targeting the bottom 10% of the households by providing them little grants of assets, just a hand-holding program so that they can move from extreme poverty to moderate poverty and depend on the market on those, as well as providing support for agriculture in order to achieve food security. These are the programs aimed to immediately increase income of the household so that we can gradually move out of poverty in India. But then we have a capacity building program because we are aware that Bangladesh has plenty of human resources, and unless we develop them, their capacity will not be able to sort of proceed in future for pursuing development. So under that we have education and health program where we provide the services free of charge, and also a disaster management program that we have recently introduced. But we also work to empower the disadvantaged peoples, and so we have a community empowerment program, a human rights and legal services program, and then a gender program, particularly sort of confidence building for women, which is a cross-cutting program across that. So that's how sort of BRAC operates. We now have about 120,000 employees and an annual budget of about 600 million in Bangladesh, and another 300 million in 10 countries outside Bangladesh that we are operating now. Now, this project, the Vision Bangladesh, is a new project under our health program, and we are all excited about this program because recently, actually in 2003, there was a survey done in Bangladesh on blindness and eye sort of related diseases, and we found that nearly about 750,000 people in Bangladesh are blind, 80% of them because of the cataract. And we know well that cataract is something that could be easily sort of operated. So this project, which focused on the Sylhet division because it's a small division, and we wanted to show that with concerted efforts that it is possible to remove this blindness. So we had a program for doing cataract operation of 100,000 for a period of 3 years. We started in January 2011, so we are just on the midway of that. It will be completed in December 2013, and we have already done 61,000 operations out of the 100,000 successfully. Some of those that we have financially made there. So we have the remaining targets of about 40,000 cataract operations. By that way, we will be able to remove the blindness which is due to cataract completely in the Sylhet division. And for those 40,000, we need about 1.4 million pounds. Actually, it takes about 20 pounds to do the operation and another 15 pounds for screening the patients for doing post-operation care and all that. So it's about 35 pounds per person. But this is such a noble cause, giving sort of light to the people, giving sight to the people is such a noble cause. and our chairperson thought that we should give a platform for the Bangladeshis who are abroad, who have improved their condition, to see whether they can share with our sort of achievement in this, contribute to this noble cause through providing some funds and others. So I hope that you will respond positively tonight to provide some support with us and be and share with the achievement of that project. Thank you very much.